Hello, my name is Chelsea Robinson, and today I'll be discussing the clinical reasoning questions for our geriatrics class. Question number 37. The OT is completing a pre-discharge evaluation after the client's 3 months of outpatient OT following a hand surgery. The individual has not been able to work for 3 months and is unable to perform all the job requirements as a truck driver. What should the OT recommend at discharge? I chose the answer C, work hardening, because the client is unable to perform job tasks, and work hardening is a program that can increase function. A, home exercise program, while it is appropriate, it is only focused on maintaining function and not regarding his work. And home health OT would only be advised if the client is a homebound client, and as it's stated in the question, he is seeing outpatient OT. Question number 1. An OT is preparing to evaluate a toddler who has upper extremity orthopedic concerns and difficulty with self-feeding while at child care. How will the OT most likely obtain initial assessment data? I chose the answer C, observation of the child during eating activities in the child care center. I chose this because it was the most direct form of way to evaluate the toddler. Measurement tools that assess visual motor skills, there were no visual motor skills that were addressed as a deficit, so it wouldn't be pertinent to start there. And also the dynamometer and pinch meter readings are not appropriate at this time as well to assess self-feeding. Question number 3. An OT working in a long-term care facility needs to evaluate the long-term memory of a resident. Which is the best for evaluating memory of personal experienced events, also known as declarative memory? I chose the answer B, ask the individual how they spent the New Year's holiday, as this is an example of declarative memory. This is the only option that recounts a personal experience. Option number A, show the person a series of objects and ask them to recall objects within 30 seconds, relates to short-term memory, not personal experienced events. Option number C relates more towards orientation. And option number D, ask the client to remember to bring a specific item to the next therapy session, is related towards planning and recalling an event, not so much a personal experience of an event. Question number 58. A person with a long history of Parkinson's disease is experiencing considerable fatigue during the day. The best way to enable the individual to maintain their level of function is to teach them how to, I chose the answer B, perform desired activities in a simplified manner to conserve energy, because it focuses on energy conservation. Option number A, working through the fatigue, is sometimes only going to increase your level of fatigue, not help maintain it. Option number C, employing pursed lip breathing, that would be used for clients with COPD, not necessarily an appropriate intervention for someone with Parkinson's at this time. Option number D, eliminate activities or reduce activity level as much as possible. Decreasing activity level would also decrease their level of function, and that's not something that we would put as a goal. We want to increase their level of function, so we would not decrease activity. Question number 61. An individual with Guillain-Barré acute syndrome demonstrates poor to fair strength throughout the upper extremities. Which is the most appropriate approach for the OT to use when planning treatment for the early stages? I chose option A, or answer number A, gentle, non-resistive activities. These are passive and gentle activities that are the most appropriate due to the muscle grade that was listed. Progressive fine motor skills and fine motor skills are appropriate, but they are not going to address this individual's poor strength as well as gentle non-resistive activities would. Question number 65. Following radiation therapy for breast cancer, an individual develops lymphedema in the right dominant upper extremity. She is experiencing functional deficits and is referred to occupational therapy. Treatment to reduce swelling will begin with, I chose option C, fitting a compression garment, because it would reduce the swelling in a specified area. Option number A is not appropriate for this time. We don't want to change the hand. We use a compensatory strategy. We want to regain the function in the right hand. So once again, that would not be appropriate. Option B, right upper extremity use of isometric contractions, does not target the swelling. So I wouldn't choose that one as well. And then option D, a heat modality such as a warm compress, would actually be a contraindication. The heat would increase blood flow, which would increase swelling. Question number 72. An OT is working with a woman with Alzheimer's disease who demonstrates mild to moderate decline. She lives with her husband, who works during the day. The OT should initially focus intervention on which area? I put B, kitchen safely, because this woman will be working at home alone. We would want to address kitchen safety first and foremost, because she's going to need to be making some of her meals, and we want to make sure that she's safe doing that. Anger management, C and D are applicable, but safety is the most important. So I would be choosing that as the first intervention to focus on. And then ability to chew and swallow wasn't mentioned as a concern at this time due to the stage of the dementia that she's in. Question number 94. An OT is treating a restaurant worker with pain resulting from a cumulative trauma disorder. The OT suggested using elastic taping to decrease pain in the upper extremity while working. In addition to decreasing pain, this type of taping can also, I chose A, decrease inflammation and edema. This is the correct answer because this is a positive symptom from taping, as well as will decrease pain. Option B was not appropriate because taping does not present muscle fatigue. Option C was not appropriate because taping does not limit range of motion. It actually allows for movement. And option D was not appropriate because taping, although it may help to sensitize the upper extremity, that is not the problem that's being addressed. Question number 99. An OT is working with an individual with ALS who developed a sacral decubitus and has recently become too weak to turn himself in bed. What should the OT plan to do next in regard to client caregiver instruction? I chose option C as the correct answer. Teach the caregiver how to position the client safely. This would be the most immediate concern as they have developed a sacral decubitus. Option A, B, and C, although they are appropriate for a person with ALS, they're not of the most immediate concern. Question number 100. A hospital-based OT is working on discharge plans for a 2-year-old with paraplegic spina bifida who has just started using a power wheelchair. Which community resource recommendation is the most critical for this child? I chose D, early intervention programs, as this could provide the most beneficial resource for this child. Option B and C, or option A, he does not need a social service agency. That wasn't listed. Option B, wheelchair equipment vendor. It may be needed, but it is not the most important intervention at this time. And a family physician, they probably already have a primary care physician if they are in hospital-based OT, so that would also not be pertinent. Question number 101. A client presents with chronic post-stroke upper extremity edema of the right arm and hand. Which would the OT most likely suggest to manage the edema? I chose option A, manual edema mobilization, as this uses massage, exercises, and compression to reduce swelling and inflammation, which is what we would want to target. Option B and C are actually contraindications because they both increase blood flow and we are trying to reduce edema. Question number 102. An individual with left upper extremity flaccidity is observed sitting at a table in his wheelchair at lunchtime with his left arm dangling over the side. The first positioning strategy the OT would introduce to this individual is, I chose B, repositioning the arm back on the wheelchair armrest. This is the most effective option, in my opinion. Option A, positioning the upper extremity on the tabletop surface with DICEM. DICEM is a good idea, but it isn't the first course of action that one should choose. Using an arm sling and attaching a lab tray also require additional equipment and wouldn't be the first course of action that you could take to prevent subluxation from this flaccid upper extremity. Question number 111. An OT is working with an individual who is status post right upper extremity shoulder replacement. The client is right hand dominant and an avid woodworker. Currently, limited right upper extremity range of motion prevents participation in woodworking, which requires at least 120 degrees of shoulder flexion. The OT and the patient collaboratively develop a plan that incorporates woodworking to increase right upper extremity range of motion. After establishing the just right challenge at 40 degrees of shoulder flexion to sand the piece of a wood project, how should the OT progress the patient to achieve this goal? I chose option D, involve them in sanding and staining increasingly larger pieces. This is the correct option because it would work on focusing on the right upper extremity and establishing more shoulder flexion during the project by grading it to be a little bit harder. Option A was not appropriate because it focuses on increasing the grade of the activity, making it harder by adding power tools and progressing to that. It does make it more difficult, but it doesn't target range of motion of the right upper extremity. Option B, applying wrist weights would focus more on strength and not on range of motion. And option C doesn't, once again, specifically focus on range of motion of the shoulder. It more focuses on bilateral coordination, which would not be appropriate for to progress this patient to achieve their goal. Question number 123. An OT is working with a 6-year-old child who is occasionally dropping their utensils when eating because of a slight decrease in hand range of motion / grasp limitation. Which piece of equipment would the OT most likely recommend first? I chose option C. The OT should recommend foam tubing around the utensil, as this would provide assistance for decreased grasp. Option A, a swivel utensil, wouldn't demonstrate, or the client does not demonstrate difficulty feeding himself. He's only demonstrating decreased grasp of the utensils, so that would not be appropriate. Pediatric universal holders would be recommended for a more severe grasp deficit like CP or paraplegia or quadriplegia. And option D, weighted utensils, would actually be a contraindication to assist with decreased grasp because they already are struggling with grasping. Adding weight to it wouldn't help that. Question number 125. A 60-year-old auto mechanic with diabetes and impaired sensation and the residual lower limb has been referred to OT for prosthetic training following an above knee amputation. The first item the OT should address is, I chose A, skin inspection. Regular skin care is crucial following an amputation, as this area is going to need some observation. It just went through a major surgery, so that would be most pertinent. Option B, nail trimming, is not a concern at this time. Option C, retirement, was not mentioned in the above, nowhere in the above options for his plan of care, so that shouldn't be addressed at this moment. And returning to work was also not a list of a first concern, so skin inspections would be the most pertinent thing to address first. Question number 129. An OT is applying proprioceptive neuromuscular facilitation, PNF techniques, for weight shifting during an activity that requires an individual to use the right hand to remove groceries from a bag on the floor to the right. The most benefit would be gained from this activity by placing the groceries where? I chose option D. In the upper cabinet to the left-hand side, this involves a full weight shift from right to left, and it's also targeting D1 extension and flexion, whereas option A, B, and C do not even emulate PNF patterns. Question number 144. An individual diagnosed with chronic obstructive pulmonary disease is participating in a pulmonary rehabilitation program, which will the OT most likely recommend? I chose option A, pursed lip breathing when doing activities, because this is an effective technique that's often recommended to COPD clients. Option B, using a long-handled sponge. Why this would help with endurance conservation, it is not the first approach I would take for someone with COPD. It's also not addressing pulmonary rehabilitation. Taking hot showers to reduce congestion. It has been said that hot showers are actually a contraindication to improve breathing for COPD clients, so I would not recommend that. And avoiding air conditioning. Air conditioning is helpful as it decreases humidity, which will help improve breathing. Question number 145. An OT is fabricating a resting hand orthotic device for an individual with extremely fragile skin. Which areas will the OT have to inspect most carefully for signs of skin breakdown? I chose option C. Ulnar styloid, distal head of radius, and thumb CMC joint are most at risk because they present as bony prominences. Option A and B are fragile areas, but they are not the first at risk. Question number 147. Which are the most appropriate interventions for the OT to plan in treating a person following a total knee replacement? I chose option C, providing ADL training and the use of adaptive techniques for lower extremity dressing and transfers. This is the appropriate answer because it focuses on occupation-based activities, which fits the role of an OT. Option A, using range of motion and strengthening activities, are not involved in this intervention plan. It is targeting a total knee replacement, which is a lower extremity. So upper extremity would not be one of the first concerns we would focus on. Providing range of motion is also an appropriate idea, but the occupation-based activities should take precedence, and this is not occupation-based, it's more physical. Observation and assessment of homemaking activities. This is a higher level activity that would be recommended further down the recovery process, or further down the road of their recovery process. So once again, providing ADL training and using adaptive equipment would be the most effective treatment at this time. The last question, question number 166. The administrator of a long-term care facility asked the OT who works there to help develop a job description so they may hire a second OT. What would an OT job description most likely contain? I chose option D, job title, employer's expectation, productivity expectations, and how performance will be measured. This is the appropriate answer because this option recommends appropriate characteristics of what a job description should entail. Option A doesn't fit OT requirements for a job description. Option B and option C, they can be parts of a job description, but they are a little bit too detailed and are not the first concern. Thank you for listening to my clinical reasoning questions for our geriatric course. Have a good night.